and welcome back to the second free workshop on navigating better healthcare and medical care. I'm Suzanne Fasella, a physician assistant. This is a long video, but go ahead and hit the settings button and set it up the way you like it at what speed you want. Sometimes I just talk too slow. I'm going to work with patients. I work with patients every day, teaching them how to advocate for themselves in a hurricane of unanswered questions and impossible medical bills. In the first workshop, we talked about the health care you can have, that you can create a life you love and not think twice about the availability of your doctor or the cost of care because you know how to master the healthcare arena. And this formula works for thousands of patients, and medical providers have been using this formula for years to care give. Now it's your turn. I left you with the realization that we really have two paths that we're going to choose when attempting to deal with the issues of healthcare strain on us. And remember that if we choose managing, we're only moving into a 24-hour day, 7-day-a-week job. There is no day off. When that shoe drops, you're either going to run to the convenient care or you're going to go to the emergency room. We have to make sure that we or our aging parents or our kids keep their doctor's treatment plan in check. That our children don't get injured, that we don't get injured on the job, that cough, cold, and flu season doesn't even take advantage of us. We get frustrated, we get angry, especially when we don't feel good. We want something to fix us fast. We never have time to be ill. And when you try to fix the outcomes, you feel guilty about your own behavior as you know you're not acting your best. But what you really want to do is use the method that thousands of doctors have been using for hundreds of years to implement change in their patients, to get better outcomes with trust, loyalty, and confidence. And these next two videos are going to talk about that. I'm going to be zeroing in on how you can create a framework to get inspired outcomes so that when you're working with your doctors and your insurance company, you have what you need. In today's video, we're going to be talking about an understanding of exactly what doctors really want and exactly what you really need. What really inspires one human being to do one thing and one human being to do another? What inspires you? You'd be surprised at what you're going to discover. And it isn't going to be what you think. How do you inspire the uninspired? What is the target of inspiration when my patients or your children, your parents, don't have an interest in doing what you want them to do? What if you or your aging parent just wants to be left alone? What if our employees just want to do the basics, the minimum? When I'm lecturing around the country to audiences on how to customize a safe, effective healthcare team, it's immediately assumed, oh, Suzanne, you don't know my doctor, you don't know my mom, you don't know my kids. As I mentioned in the last video, I was a high school science teacher for years. Showing the love of education and teaching and training and challenging and raising students to be all they could be has always been a part of who I am. And one day, when I was teaching school, I was having this parent-teacher conference. And I told the parent what a lovely child he had. I said he was articulate, he was well-behaved, and he encouraged others. And as I was espousing the virtues of this student, the father started shuffling through his wallet, and he pulled out a picture of his son, my student. And he said, "Is this the right kid we're talking about?" It happens in medicine too. For example, the son comes in and has told his dad 1,000 times he can't drive. But dad's going to drive because dad's going to do what he wants to do. And yet I can tell dad once not to drive, and all of a sudden it's like, oh, okay. And the son just rolls his eyes. People managing people assume that maybe they should have a drawer full of chocolates at their desk or be in some kind of financial position to give wads of cash out to the employee's behavior so they feel reinforced. And although all of these things we're talking about are going to be reinforcing to some individuals on some level, the biggest transformation in behavior or outcomes do not occur in the traditional way of thinking about rewarding. I'm not saying that rewards can't have an impact on behavior or outcomes. My suggestion is that truly the best rewards are those that create the longest lasting and biggest impact as a result of giving the patient and the doctor an opportunity to choose, the power of choice, the power to create their own outcome. Parent-teacher conferences were often thick with judgment, blame, criticism. And when I could stop the ill will between the parents and the child and get the student to open up and make their own choices on how to fix whatever dilemma we were dealing with, he or she moved mountains to get it done. It is truly amazing to see what children can do when someone believes in them. This clarity builds confidence. Since consequences are a powerful driving force, nothing can compete with a reinforcement value received when a person of choice produces the consequences of a highly desired positive outcome. And it's the same for you too. In this way, it is you, the patient, who creates a pathway of your own rewards inspired by a caregiving team that you created. This is an addiction of sorts. So now, let's look at how you are going to become a part of this choice and how your doctor is going to become a part of this choice. Both of you working together will agree to give each other what you need. And remember, your doctor is a human too. And when you believe in their ability, take their advice, accomplish a highly positive outcome, the trust, the truth, and the clarity build confidence that you two can work together and no force, no issues can come between a team of exceptional clarity. We talked about steps 1 and 2 in the previous video, and we spoke about the receptionist at the front desk and how much he or she has to do. And yes, they also have to take cash and co-pays. I forgot that job description part too. Their job description never seems to end. But we also talked about step 2. And we talked about being called to the back into the exam room. And before you reach the exam room, you've got to get weighed and you've got to get your vitals taken. And this is all part of measuring how well you're doing and also to ensure that the doctor gets paid for by the insurance company. We will go over your medications, what pharmacy you want to use if you need a medication. And then the nurse says, or the CMA says, oh, the doctor will be right in. But now you know better. So you're going to settle in that chair, you're going to get a blanket, water, or a good book to read. Surprise, the doctor comes in faster than you thought. Now, let's move on to steps 3, 4, 5, and 6. The doctor, the nurse practitioner, or the PA walks in. First of all, they have to go through all 4 steps: subjective, objective, assessment, and plan. Don't let these bother you. I'm going to go over each and every one of them. This is the office note, not your chart. Your chart is filled with 22 parts of information from all your office visits, your surgeries, your hospitalizations, your medications, your billing, your insurance, emergency contacts. It covers everything, and we talked about it in the previous video. But the SOAP note is only about today's office visit. The SOAP note is what is happening today, while the chart is a history of everything since you were born. The doctor is going to ask you several questions. Some patients get a little huffed at me because I go in and start asking questions and they're like, I just told the nurse all that. But I'll show you why you have to give it to your doctor or your provider again. How long has this been going on? That would be my first question. 2 days, 3 days, 2 years, 4 days, weeks, months. You may think that a while, and many people say a while, means something, but it means nothing to us. Because you may think a while is 2 days, whereas the patient behind you thinks a while is 2 years. When I was in PA school, we had to take a whole class on the SOAP note in charting and how to do it. And in the first day of class, the professor says to us all, what's the most important part of the office visit? And we all shout out, oh, the exam, the objective, it's got to be. You got to look at the patient. And he said, absolutely not. The most important part of the exam is the subjective. What does the patient need? What does the patient want? And they will tell you in a roundabout way. You'll ask enough questions until you can figure out what's really going on with the patient. Boy, has this always been true. In the years I've been practicing medicine, not a more believable statement. And we can go over this again and again, but there's basically 8 things I need to ask you in order to fill out this SOAP note, okay? And then the doctor may even ask you where it's located. If you have a pain, where it's located. Is it radiating? And the doctor may even start examining you, which is the objective part. Many of us are experienced enough where we can ask you questions and start examining you at the same time. So let's go back to a subjective. Approximately 8 questions. Is it better? Is it worse? What treatment have you tried on it? We have to document all of this in order to get paid. Now, during this time I'm asking you questions, you have to give me answers. You can't go off on a long story about how you were cooking Sunday dinner and you were having mashed potatoes and ham and salad and a pie for dessert, and then you were going to go get some ice cream for the pie, but the kitchen cabinet was open and you didn't know it was there and you hit your head and now you're in the urgent care because you got a laceration in the forehead. Suffice to keep it short, I bumped my head on a kitchen cabinet and here I am. Or let's say you have a mole that you want me to look at. Okay. Where's the mole? How long have you had it? Is it getting better? Is it getting worse? Have you tried anything for it? Have you put on a cream? I'm going to ask you what kind of cream. I'm going to ask you to show me the box. I have to know what kind of cream it is. You have to bring it with you. These are answers I have to these questions. And these questions will tell me everything that I can possibly think of while I'm asking them in order to figure out your diagnosis. For example, let's say you have a really bad cough. What else do you have? And then you tell me you have a fever. Okay, so now this is more than a cough. I've got a fever to contend with. What kind of cough also causes a fever? Well, there are about 12 different types of cough. But now I have to figure out what kind is this one. And while I'm asking you, or your doctor is asking you all these questions, we are doing something called a mental gymnastics. Mental gymnastics means that in seconds we are going through a list of diagnoses and analyzing which each one could be and what it's going to be and what it's not going to be. We do it in seconds. Understand that your doctor spent years going through hospitals, exam rooms, and clinics in order to be able to diagnose you that fast. And he or she has the confidence and the clarity to ask the right questions. And I hope this makes sense. And what's critical is when the doctor comes in and doesn't ask any questions or doesn't listen to your answers, because it's the most important part of the exam, of the whole office visit. And so what you have to do there is you have to start giving them answers to questions they're not even going to ask, and we're going to teach you how to do that. This program is developed so you can start off real slow with the beginners, and then we're going to move on. We're going to take bite-sized pieces, baby steps, if you will. And then we'll advance to intermediate and eventually more. It's like riding a bike. You have to find where the brakes are first before you go pedaling. If you're going to swim, you have to learn how to float or grab the side of the pool before you start to swim. So we've got to start with the basics first, and then we're going to branch out. And some of you are going to get so good at this that you're even going to become advocates for even your doctors, and you're going to work in their practices and show people how to put their charts together, or you're going to become a professional advocate and get paid for it from your clients. So we're going to do all of this. We're going to start with the basics and deep dive. So questions are the name of the game. Okay, the next part is the objective, and the objective really gets interesting. You see, the objective is anything we touch, hear, smell, taste, see. And a lot of you know my story. My dad was an old country doctor. And when I was 11 years old, I was working in his office, and my dad would have the patient pee in a cup. And then they'd bring in the cup and set it on the desk, and Dad would stick his finger in the cup and lick his finger. It was so gross. But he explained to me that he had to see if the urine was sweet, because it's the only way he could tell if his patients had diabetes or not. I think we've come a long way. So always for objective, anything that can be measured, or the exam, the labs, your x-rays, your CT scans, your colonoscopies, your mammograms, your density scans, anything that we can test for falls under this category. A is for assessment or diagnosis, and be careful what you ask for there. I'll explain that. And then P is for plan. We have to be able to discuss your plan of treatment. Let's go back to the cough. You have a cough. I know you have a cough. You came in for a cough. Is my complaint my diagnosis? Yes, it can be. Assessment is a cough. A diagnosis is a cough. It can be the same thing, okay? And when we get down to plan, we got to talk about, are you going to get x-rays? Are you going to have to come back in 3 months? Are you going to get labs? Are you going to end up in a specialist's office? So many different things. But one of the things I want you to understand is that nobody can order anything on the plan unless they're a licensed physician, nurse practitioner, or PA. Nobody. And this is why the office visit is so important, because everything launches from the office visit. This plan can wreak havoc on you. And I often used to tell my students, I trained this. When you write an order, you have to think about transportation, you have to think about the prep, you have to think if the patient can afford it, you have to think if their insurance is going to cover it, you have to think if their kids are going to have to take off work to take them, or leave work for their own preps and their own tests, how expensive it's going to be. The money, the burden, and the time that we put on patients because we write an order. We can destroy their social life and their family life getting this thing done. The philosophy is, if you can test for it, should you or shouldn't you? And each provider has to decide that. It's an extremely, extremely important part of the office visit. And yet it's the last one, and it shouldn't be, because we want time to discuss it. We discussed a lot up here. Shouldn't we discuss a lot down here? That's what I'm talking about. So this is one of those deep dives, and we'll get back to it later. But let's review. We have a SOAP note. Did you answer all the doctor's questions quickly and straightforward? And did you tell the doctor the truth? The objective, the O, is the exam and any accompanying tests, vital signs, x-rays, CT scans. A is for assessment or diagnosis, and then the plan. One trick, I already told you one thing about a while. Nobody likes the word a while because it doesn't tell us anything. We need the number of days, weeks, months, or years that your issue has been occurring. And the other thing is, when I'm listening to your body, your chest, your belly, or anything like that, I can't hear through my stethoscope. What happens is, when I have these in my ears, all I can hear is, sounds like a bad speaker in a fast food drive-through restaurant. So if you're talking to me, I can't hear it. And the other thing is, sometimes I can either pull it out or I can kind of stop listening and then I have to listen to you. But I cannot really hear well. None of us can. And the other thing is, if this thing is here, do not speak. It absolutely deafens us. Now let's bring up another point I have. I forgot to put this on, so whoops, wait, we'll put that on so you can hear me better. Let's say you come in and you're complaining about your foot hurts. Well, I got to see both feet. I have to compare one to the other. If you're complaining about an elbow or a shoulder, we compare one with the other. And yet you keep your shoes and socks on. Well, I have to have you take off your shoes and socks. And so you get your shoe off pretty easily. But then to pull the sock off, you reach it and you pull and pull and pull. And I just got to tell you, I hate this, because when you pull, the sock flings in the air. And these exam rooms are really quite small. And I just inhaled all your skin cells from your feet. So really, would you get your socks and shoes off before you come in? All right? Now let's say you have a cough. I have to know what kind of cough it is. Is it a ACE inhibitor cough? Is it a postnasal cough? Is it a pneumonia cough? Is it a GERD cough? Is it a heart failure cough? I have to think of all these things. Rashes, there are thousands of rashes out there, so I've got to know which one it is. Could it be contact dermatitis or shingles? Is it just a fungal rash? There's so many diagnoses. So we have something called a differential diagnosis, and it's a backup in case the first plan doesn't work. We have something called differentials. So the next question is, what do we do if the plan doesn't work? Are you going to come back? How are you going to get in the office? It takes 3 months to get an appointment. Are you going to text your doctor? Can you call your doctor's cell phone? You know, I went to an eye doctor once to have my eyes checked. And it's my annual visit. And when I went up to the building in the parking lot, I knew I was in trouble. His building was huge and it had his name on it with neon lights and all that stuff. And the first thing the assistant said to me when she pulled me back was, "Oh, we're going to start an IV and put some contrast in your arm." And I said, "Ask questions." "No, I want to know why." And she said, "Well, he wants to get a better look at your eyes." And I said, "Doesn't he have the right equipment? Does he have old equipment or something?" But she said, "No, never mind, we're not going to do that." But I had to ask, and at least I did. So the next thing, I'm called back into one of his 18 exam rooms. He comes in, he looks up, he tells me to look up, look down, look left, look right, and he leaves. He walks right out. I didn't have a chance to say hello. And the nurse comes in and says, oh, the doctor wants to see you back in 3 months. Well, I only get my eyes checked every year. So now I'm worried. What did the doctor see? She goes to ask the doctor, who never does come back in. And she says, oh, okay, so he'll see you in 6 months. And I said, 6 months? That's not an answer. What is the diagnosis? I need to know what he saw. I need a diagnosis. So she goes out, she comes back in and she goes, okay, he'll see you in 2 years. Well, needless to say, I didn't go back to him. Maybe he was practicing very thorough medicine, and maybe he was looking for all sorts of things in his patients. He just wasn't the doctor for me. If you say you see something, you better give me a diagnosis on it. But to each his own. So let's review. The doctor is going to ask you about 8 questions or so in the subjective. And what we have to know here is that I'm doing this mental gymnastics as I'm asking you every question so that I can carefully consider what I'm going to do next. And then I'm going to do the exam. And then I've got to talk to you about the diagnosis and or the differentials I'm thinking. And then what is the plan going to do for you? If it's a medication, don't ask the doctor about the side effects. Ask a pharmacist, not a pharm tech, but actually the pharmacist. They are the specialists in medicine. They know more about medicines than most of the physicians do. So again, there's a whole nother video we can do on medications, and I do it because I want you to understand how it works. So make sure you always ask the pharmacist. Now, let's talk about a diagnosis for a minute. If the doctor puts something in your chart, it takes an act of Congress to get it back out. I went to a doctor once, a friend of mine, and he said, how are you sleeping? And I said, I sleep okay. If I wake up, I get back to sleep again. He said, how's your back? I said, my back's fine, Who doesn't have a back that hurts every once in a while at my age, right? But when I got a copy of the office visit, the SOAP note, he had insomnia, backache, late lumbar sprain, muscle spasm. It was ridiculous. I made him take it out of my chart. And what if the treatment doesn't work the plan? Should I set up another appointment before I leave the doctor's office and then cancel it if I am better? It all depends on the conversation you have with your physician. We'll talk more about that later. But remember, these are baby steps. And in workshop number 3, I'm going to give you a blueprint of all the 6 areas you want to capture in your health care and your life. The Patient Formula Blueprint is a 10-page outline, and I have never given it out to anyone before. And the outline of how our charts look and what your doctor's chart looks like in every aspect of your incredible life. You're going to see how much more you know than you knew before when you start to see your chart. We must change things that are not working for you and your doctor and find the things that do. Doctors are human too, and humans want to win. And we need to put in place this winning environment. And it comes with choice. For your health care, it is a critical key in their success when you're looking for any behavior change. How can you set your own stage in healthcare to create choices that produce positive outcomes, which are a win-win-win for everybody? I'm going to leave you with that thought. It may seem like an overwhelming task right now, but in the next workshop, I'm going to show you how to break this huge task into manageable chunks to set up success for everyone, especially you. And I want to thank you too for your amazing comments that you have left on workshop 1. And also to thank you for sharing these free workshops with your friends and your family. I had no idea that there was this much interest. I hope that you take pride in knowing that by sharing this knowledge with your friends, you're going to change the way we do medicine and healthcare. For that, I thank you. I thank you for being you. So please continue to leave your comments below, and you can always write me at Suzanne@patientbest.com.